Understanding mental health. Mental health refers to a person's emotional, psychological, and social well-being. It affects how individuals think, feel, and behave, as well as how they handle stress, relate to others, and make choices in their daily lives. Mental health encompasses a wide range of conditions and experiences. It includes both positive mental health, which is the presence of well-being and resilience, and mental illnesses, which are medical conditions that can disrupt a person's thinking, mood, behavior, and daily functioning. Mental illnesses can manifest in various forms, such as depression, anxiety disorders, bipolar disorder, schizophrenia, and eating disorders. Just as physical health can range from excellent to poor, mental health can also vary from thriving to struggling. Many factors contribute to mental health, including genetic predisposition, brain chemistry, life experiences, family history of mental health problems, and individual coping mechanisms. Promoting good mental health involves taking care of oneself holistically, such as maintaining a healthy lifestyle, seeking social support, managing stress, practicing self-care, and accessing appropriate mental health resources when needed. Mental health awareness, education, and reducing the stigma surrounding mental health conditions are also crucial for fostering a supportive and understanding society. Causes of mental health problems. The causes of mental health problems are complex and multifaceted. Mental health issues can arise due to a combination of various factors, including biological factors. Some mental health problems have a biological basis. Imbalances in brain chemistry, genetic factors, and family history of mental health disorders can increase the risk of developing certain conditions. For example, conditions like depression, schizophrenia, and bipolar disorder are believed to have a strong biological component. Environmental factors. Environmental factors can significantly impact mental health. Adverse experiences, such as childhood trauma, abuse, neglect, or living in a dysfunctional family environment, can increase the risk of developing mental health problems later in life. Other environmental factors like chronic stress, poverty, social isolation, discrimination, and exposure to violence or trauma can also contribute to mental health issues. Psychological factors. Individual psychological factors and personality traits can influence mental health. For example, individuals with low self-esteem, poor coping skills, or a negative outlook on life may be more vulnerable to developing mental health problems. Additionally, certain personality disorders, such as borderline personality disorder or obsessive-compulsive personality disorder, can contribute to mental health challenges. Social and cultural factors. Societal and cultural factors play a role in mental health. Factors like societal expectations, cultural norms, gender roles, and social support systems can impact an individual's mental well-being. Marginalization, discrimination, and lack of access to resources and mental health care can also contribute to developing or exacerbating mental health issues. Substance abuse. Substance abuse and addiction can significantly impact mental health. Substance abuse often co-occurs with mental health disorders, and the misuse of substances can worsen existing mental health conditions or contribute to the development of new ones. It's important to note that mental health problems are rarely caused by a single factor but rather result from a complex interaction of various biological, environmental, psychological, and social factors. Understanding these causes can help inform prevention efforts, early intervention, and the development of effective treatment approaches for mental health problems. Measures to tackle mental health problems. Tackling mental health problems requires a comprehensive and multifaceted approach. Here are some key measures that can help address mental health issues. Awareness and education. Promote mental health awareness and education to reduce the stigma surrounding mental health. Educate the public about common mental health conditions, their signs and symptoms, and available resources for support and treatment. Access to mental health services. Improve access to affordable and quality mental health services, including counseling, therapy, and psychiatric care. Increase the availability of mental health professionals in underserved areas and ensure that mental health care is included in healthcare coverage. Early intervention. Implement early identification and intervention programs to identify mental health issues at an early stage. This can involve mental health screenings in schools, workplaces, and healthcare settings, as well as training for professionals to recognize signs of mental distress. Suicide prevention. Develop and implement suicide prevention strategies, including helplines, crisis hotlines, and community outreach programs. Focus on reducing risk factors, promoting protective factors, and providing support to individuals at risk of suicide. Supportive environments. Foster supportive environments that promote mental well-being. This includes creating mentally healthy workplaces, schools, and communities that prioritize mental health, provide resources for stress management, and promote work-life balance. Mental health in schools. Integrate mental health education and support services into school curricula. Train teachers and school staff to identify and address mental health concerns among students. Provide counseling services and create a safe and inclusive environment for students to seek help. Peer support and community programs. Establish peer support programs and community-based initiatives that facilitate social connections, reduce isolation, and provide support for individuals with mental health problems. Peer support can be highly effective in promoting recovery and reducing stigma. Research and innovation. Invest in research to better understand the causes, prevention, and treatment of mental health problems. Support innovation in mental health technologies, such as digital mental health tools and telemedicine, to increase access to care. Collaboration and coordination. Foster collaboration among different stakeholders, including government agencies, healthcare providers, community organizations, and individuals with lived experience of mental health problems. Work together to develop comprehensive mental health policies, improve service coordination, and address systemic barriers. Holistic approach to health. Recognize the interconnection between mental health and physical health. Promote a holistic approach to health that emphasizes the importance of self-care, healthy lifestyle choices, physical activity, and proper nutrition in supporting mental well-being. These measures can contribute to creating a supportive and inclusive society that prioritizes mental health, reduces stigma, and ensures that individuals with mental health problems receive the care and support they need.